All right, today we're tackling a question that, let's be honest, most of us hope to never face. When resources are tight, how do we decide who gets life-saving care? We're going to dive into this by looking at a hypothetical case that really gets to the heart of some of the toughest decisions in medicine.
Okay, so to really get our heads around this, let's start with a human story. Now, I want to be super clear, this is a hypothetical scenario. But it gets right to the heart of the kind of gut-wrenching decisions that doctors and nurses have to make every day.
So picture this. We have an 81-year-old woman. She's been dealing with some pretty serious breathing issues for a long time. We're talking COPD and chronic asthma. And for her health care, she depends on the hospital's charity services.
Then, one day, things take a terrifying turn. She suddenly can't breathe. Her skin actually starts turning blue from the lack of oxygen, and she loses consciousness. It's an absolute emergency. She gets rushed to the hospital, and they have to intubate her right away just to keep her alive. So, fast forward a month, and nothing has changed. She's still comatose. Her eyes might open on their own, but there's no recognition, no response to anything or anyone. The doctors come back with a diagnosis. She's in a persistent vegetative state. Basically, this means her brain has lost the ability for any kind of conscious thought or action.
And this is where things get incredibly complicated. This exact situation forces us to face a huge ethical dilemma, one that's right at the core of modern medicine.
So it all boils down to this one really tough question. Why would it ever be acceptable to think about withholding or even withdrawing treatment from this patient?
To even begin to answer that, you really have to understand this constant push and pull in healthcare. It's this fundamental clash between what we wish we could do and what we can actually do with the resources we have.
And yeah, this slide lays it out perfectly. On one hand, you have the ideal, right? You want to do everything possible for every single patient. You hold out for that 1 in a million miracle. But then, there's reality. The fact is, hospitals have limited resources. We're talking beds, staff, ventilators, the whole shebang. And every resource dedicated to this one patient is a resource that's not available for someone else who might have a much better shot at recovery. So what do you do? How do you even begin to make a choice like that? Well, that's where the field of bioethics comes in. It doesn't give you easy answers, but it does offer a kind of framework, a set of principles to help guide these unbelievably tough decisions with as much compassion as possible.
Okay, so a really key idea here is something called extraordinary treatment. You might think that just means super expensive, but it's more than that. We're talking about procedures that honestly offer very little hope for recovery. Or maybe they're just an incredible burden, not just on the patient, but on their family and even the healthcare system as a whole, without much of a real benefit to show for it.
And this quote really sums it up. No one is asked to do an exercise in futility or the impossible. Think about what that means. Are we ethically required to keep trying something that's just not going to work? The answer in medical ethics is actually no. There's no obligation to do the impossible or to pursue something that's futile.
Now, it's so important to get this next part right. The reason for even thinking this way isn't just about saving a few bucks. That's a common misunderstanding. The true intention here is much bigger. It's about taking care of the entire community.
So when you boil it all down, the goal has two main parts. First, you want to serve as many patients as you possibly can. And second, the only way to do that is to be smart and fair about how you use those scarce resources. It's all about stewardship, finding that balance to provide the best possible service to the most people.
And that really leaves us with a huge question, one that goes way beyond this single hypothetical case and the walls of any one hospital. In a world where we know resources aren't infinite, what is our responsibility to each other? How do we define what it means to care for one another as a society? There are no easy answers here, right? But it's a question that, frankly, affects every single one of us.